So nerves of upper limb. Nerves of upper limb. We will start nerves of upper limb. Okay. So it's so simple. First of all, you have to remember that there are nerves of upper limb are axillary nerve, musculocutaneous nerve, radial nerve, medial nerve, and ulnar nerve, and recurrent branch of medial nerve. These are the main nerve. Okay, main nerve. You can remember this arm, axillary, radial, medial nerve. If the now First of all, you have to remember that there are main nerve are auxiliary, musculocutaneous, radial, medial, and ulnar nerve. Okay, and recurrent branch of medial nerve. Other are also nerve, but that are not important. Okay, but they are just supplied to single muscle. Now, auxiliary nerve supply to deltoid muscle. Supply to the deltoid muscle. Musculocutaneous nerve supply to the brachial to the brachium, brachialis, and BBC. Actually, BBC they supply to the brachioradialis, to to brachium, brachialis. Okay, uh, to arm muscle, to anterior arm, to anterior muscle of the arm. Okay, and the radial nerve supply to all posterior muscle of the arm and arm and the forearm. Medial nerve supply to the forearm, to the muscle of the forearm, and also some muscle of the hand. Ulnar nerve supply to the most of the hand muscle. Okay, you have to just remember this. Now another thing, now see here that this is the auxiliary nerve. Auxiliary nerve come here and supply to the deltoid muscle. This is the radial nerve. Nerve move posterior to the humerus and supply to the posterior muscle of the fore. This is the arm. This is the arm, and this is the forearm. To the posterior side of the posterior muscle of the arm and forearm. This is the ulnar nerve. Ulnar nerve arises to a medial side and there goes here and supply to the muscle of the hand. Okay. This is the musculocutaneous nerve. Is musculocutaneous. Musculocutaneous arises from the lateral cord and supply to the forearm, to the arm anterior side of the anterior muscle of the arm. And this is the medial nerve. Medial nerve come here and supply to the forearm of anterior side of the forearm. This is simply just like this. Okay, now we will discuss that how these nerves are arise and not now. So first of all these nerves are arise from the, you have to simply remember that all nerve are arises from the C5, from the roots. These all nerve arise from the spinal cord or from the spinal cord are okay, from the C5, C6, C5, C6, C7, C8, and T1. Okay, they arise from this area, and this is called brachial plexus. So we will tell about now. We will tell all about the brachial plexus. Okay, that what is brachial plexus and what is not brachial plexus. Okay. Now, first of all, these are the root you have in the brachial plexus. This is the brachial plexus. Brachial plexus. In brachial plexus, you have to understand. In the brachial plexus, you have to understand that there are roots, trunk. You have to understand. You have to understand that root are RTDC. You have to understand this. So in the brachial plexus, there are the roots that the nerve arise from this. So you have to write these things. Okay. After that, you have to combine C5 and C8, and then C8 and T1. You combine this and move ahead. So this is trunk. This is the superior trunk and this is the inferior trunk, and between them this is the middle trunk. Now after this the division come. After this the divisions come. Division, and this is superior trunk. From superior trunk there is the anterior division, and one is the from the middle trunk. There's also anterior division. They come here, okay, and they form. This is the anterior division. This is also the anterior division, okay, and from this area the anterior division move and form a chord. Now this is the divisions, okay, and now here are also the posterior division. This is the posterior division. Posterior division from the superior trunk, posterior division from the middle trunk, posterior division from the inferior trunk. They combine and they form a posterior cord. This is the posterior cord, okay, and this is the lateral cord. We will see why this is called lateral cord, and this is actually medial cord. This is actually medial cord, okay. This is actually medial cord. Now after this I have discussed this. Now what you have to see, you have to understand what you have to understand. Now from the lateral cord and from the posterior cord, when posterior cord move, they form the radial nerve. When they move, they form the radial nerve and one musculocutaneous radial nerve, and another. Now lateral cord goes on and form musculocutaneous nerve. Cutaneous nerve, okay. The medial cord. Now you have to understand that there are also the medial nerve. We have discussed the musculocutaneous nerve, radial nerve. Two main nerves are discussed, okay. Now from the medial cord there are one medial branch. This is the branch with the medial cord, and one branch from the lateral cord. They move here and they combine and they form a nerve that is called median nerve, okay. They form the median nerve. They both combine and they form a median nerve. Another is the posterior cord is the radial, okay. Another is the medial cord move ahead and they form another nerve that is called ulnar nerve. That is from ulnar nerve. Musculocutaneous nerve, radial nerve, median nerve, ulnar nerve. These four nerves are completed. Now what nerve are remain we will discuss, okay. Another nerve is the auxiliary nerve, okay. So auxiliary nerve arise from the auxiliary nerve arise. This is the auxiliary nerve arise from the posterior cord. So the main nerve are, we have write all the main nerve that is important, okay. So these are the main nerve, auxiliary nerve. Now we will go deep and find all the nerves that is present, okay. So you have to understand here. Now just I have go over you. Now you have again here are from the trunk. You have to understand these all nerves are arise from the cord, okay, from the cord. But now we have to tell that from the root which nerve arise. From the root, one nerve is from the root that is called dorsal scapular nerve, okay, and one is the branch of the phrenic nerve. Phrenic nerve arise from the upper root and also from the C5, okay. You have to understand this. Another is from the superior cord. There is called the lateral. There is called subscapular nerve. Subscapular nerve, okay. Another nerve is the subscapular nerve. Subscapular arise from this area, and another is also subclavius. Nerve to subclavius also arise from the superior trunk. Now you have up to this you can remember this simply. It's so okay. Now we will just add little bit information, but that if you can't remember that, it's not so much important, okay. But this is so much important, you have to remember this, okay. Now from the trunk we have another thing is from the root, from C5, C6 and C7. From this root, the long thoracic nerve are arises from this area. Okay. Now from this area, these nerve are arise. Now from the end, from the division, there is no nerve arise. Now from the card, you have to understand which nerves are arise. From the medial, there is you have, along with the medial, you have to understand that M M M M U. From the medial card, there are many nerve arise. Okay. One is the medial cutaneous nerve of forearm, medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Okay. Medial pectoral, and another is the medial pectoral nerve. You have to answer that from the medial there are nerve arises 4M and 1U. 4M mean that medial pectoral nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and medial branch of median nerve. So this mnemonic you can write it with the medial card, and with the lateral card you have to remember this L M L MLM. Okay. And what this mean? ML, no, we write it. Let ML. Okay, it's okay. So write it the M L M L LML. So from this area you can understand it's from the lateral card. There are three nerve arise. One nerve is the lateral card of the median nerve, and another is the lateral pectoral nerve, and another is the musculocutaneous nerve. So these three nerve arise from the lateral card. What? L M L. What it means? It means that first is the lateral pectoral nerve, and another is from the another arise from it and form a lateral card of the median nerve, one branch and form lateral card. This is the branch from the lateral card. So lateral branch of the median nerve. Another is the musculocutaneous. So lateral pectoral nerve, musculocutaneous nerve, and lateral card of median nerve. Okay. Now from the card, this nerve, and from the posterior card, what nerve are arise from the posterior card? So to remember this, you have to understand that thoraco dorsal nerve. Okay. Now from the posterior card, you have to understand that there are also three nerves. One is the superior and one is the inferior. Superior subscapular nerve and inferior subscapular nerve, and another is the thoraco dorsal nerve. You have to remember this. Thoraco dorsal nerve is arise from the posterior cord. Okay, it's so easy. Superior subscapular, inferior subscapular nerve, and thoraco dorsal nerve. These arise from the posterior cord. Okay, and also axillary nerve, radial nerve. These have we already have discussed. Okay. So the all the nerves are discussed in this video with you. Okay, now no nerves are remaining here. Okay, so after this we will discuss another thing that is very important. So you have to remember this and draw this chart very much again and again. Now we will tell that why it is called lateral card or medial card, etc. Okay, so about this we discuss something. Let's wait for it. So this is actually the root C5, C6, C5, C6, C7, C8, T1. So this is actually present in the axilla. Okay, so they come here and there is dorsal scapular nerve, and this is the long thoracic nerve. Okay, now this is the this is actually superior cord, this is the medial cord, and this is the inferior cord. Okay, so from this area the branches come go on. This is the anterior, this is actually the anterior division of the superior cord, this is the anterior division of the middle cord, and this is the anterior division of the inferior cord. So you can see it, you can see it. Okay, this is the anterior division of the superior cord and the middle cord, and they form a nerve, and this nerve is called what, they form a cord. This is called lateral cord because this is the auxiliary artery, and in the auxiliary artery they are to the lateral side, and this is medial, this is the medial cord because it is medial to the auxiliary artery, and posterior side there is called posterior cord because it is posterior to the cord, and this posterior have branch from all nerve, from all cord, from the superior, from all root, from all trunk, superior trunk this is branch come, and from the middle trunk this branches come, and from the inferior cord this branch come. So it got all the branches. Okay, radial nerve. Now this move posteriorly and form a radial nerve and radial nerve. Okay, we other things are already we have discussed. Okay, so this is simple explanation with you, and you can know about this, that all the nerves we have discussed it. Okay, and their blood and their muscles, etc. We will discuss that in the next video. Okay, or in this video. So this is about the nerve and which muscle are supplied by this. We will explain it. Okay, so thanks. So in this video we will discuss all the muscle of upper limb. Okay, we have already discussed the nerve of upper limb. Now we will discuss the muscle of the upper limb, and also that which muscle is supplied by which nerves. Okay, so now first of all come here to the one by one. Okay, so this is the actually the muscular skeleton. Okay, so first of all we will start from the humerus. Okay, this is the deltoid muscle. Deltoid muscle, you can see it, deltoid muscle. And another thing is about the its insertion. Actually its insertion is actually deltoid to posterior to the lateral side of the body and head, and attached to the attachment. Where is the origin? Lateral third of the clavicle. There are three muscle or deltoid, or one is the this is deltoid anterior head because this is anterior side deltoid. This is the right side middle, and this is the posterior side, and you can see that the anterior side is attached to the clavicle, to the two-third of the clavicle. Okay, this is attached to the acromion. Okay, this is attached to the acromion. Okay, and this is attached to the posterior side to the spine of the scapula. Okay, so remove this deltoid muscle. So this is the deltoid muscle, and to deltoid muscle there is the nerve supply are the auxiliary nerve. Okay, now we remove this. Now again we see to the anterior side of the arm. Here are the biceps muscle. This is the short head of the biceps, and the short head of the bicep is actually attached to the coracobrachialis. There is a coracobrachialis present, and they attach to a coracobrachialis. This is the short head of the biceps brachii, and this is the long head. The long head moves through this bicipital groove and attach here to the supraglenoid supraglenoids. Okay, so this is the biceps muscle. This is short head and this is long head. You can also just what is called, now this is the biceps muscle, so hide it. Now another is about, this is the brachialis muscle. What, this is actually the brachialis muscle. We also remove one another muscle, but coracobrachialis. Okay. So this is actually the brachialis muscle. Brachialis muscle is attached to the humerus at the mid, okay, and move here to the olecranon fossa. So this is the brachialis muscle. Now, so in the anterior, so you have to remember that anterior side there are two muscles. One is the brachialis muscle, okay. Another is the coracobrachialis muscle, and another is the bi biceps brachii. Biceps brachii, and one is the biceps brachii start from this because these have two head bicep. Okay, one is and another is the brachialis. Brachialis start from another is the coracobrachialis. Coracobrachialis start from here and move toward it. Okay, so anterior side there are three muscles BBC, and these BBC there the muscle for to this muscle there is the nerve supply that is called musculocutaneous. Musculocutaneous nerve supply to this area. Okay. Now we will move to next thing is to the posterior side of the arm. To posterior side of the arm there are the tricep muscle. Tricep muscle have three head. One is the lateral head because this to the lateral side. One is the short head, long head. Okay, this is the long head. This is the lateral head, and another is other is also called this is the medial head. So there are three head. One is the lateral head, one is the long head, one is the medial head. So there is not short head. So just remove it. Okay, so we have removed the tricep muscle, and to the tricep muscle is supplied by the radial nerve. Okay, radial nerve move posterior side. Okay, now again we will move to the to the forearm muscle. What is about the forearm muscle? So for forearm muscle are actually this is the brachioradialis. Brachioradialis is start from here, and to the brachioradialis there is the radial nerve supply. Okay, and all the anterior muscle or the flexor muscle are started from our origin from the medial epicondyle. This is the medial epicondyle of the humerus. Okay, so this is the pronator teres. And another thing you have to remember this the there is the this is the cubital fossa. Okay, cubital fossa. This cubital fossa are the border of this is brachioradialis and pronator teres. So this is pronator teres. We remove the pronator teres. Another is the flexor carpi radialis because it come here and attached to the carpi muscle. Carpi bones. Okay, there are carpi bones. So just remove it. And another is it is to the radius side. That's why it is called flexor. All muscles are called flexor. So this flexor and it attached to a carpal bone. So that's why it is called flexor carpi and radialis to the lateral side. That's why it is called radialis. Now again there is another muscle that is called bicep. This is a bicipital aponeurosis. This bicipital aponeurosis help to prevent the content of the cubital fossa. Okay. The muscle is called the another muscle is here are the palmaris longus. This is the palmaris longus. Start from here and go to the and attach to a flexor retinaculum. Okay. Another is the flexor digitorum superficialis. This is flexor digitorum superficialis. And superficialis have two head. One is from the humeral head and one is the radial head. This is to the radial side. Okay. Origin from one is the ulnar head. Correct. Origin is the humeral head, medial epicondyle, ulnar head, coracoid. Ulnar head is the actually coracoid process, and radial head below the radial tuberosity. There are radial tuberosity, and from this area they have three origin. And insertion is to the medial phalanx of the digit 2 to 5 from medial phalanx of digit 2 to 5, 2, 3, 4, 5. To this area they are attached. Okay. Now after this you can see flexor digitorum superficialis. This is flexor digitorum superficialis. To remove it below this you will see other muscle that is called the flexor digitorum profundus, and it have only one only one origin, that is the proximal 3/4 of the anterior and medial surface of the ulnar and interosseous membrane. It also arises from the interosseous membrane and the ulnar side. Okay, now just remove it and you will see all other muscle. Okay, now another muscle, this is called flexor carpi ulnaris. There in the deep there are three muscles: flexor carpi ulnaris. We have discussed flexor. This is flexor carpi ulnaris. Another is there is called flexor pollicis longus. These are attached to the pollicis. Okay, that's why it is called pollicis. To the thumb, that's why it's called pollicis longus, and to the long and to the end, that's why it is called longus. So remove flexor pollicis longus and flexor carpi ulnaris. Their flexor carpi radialis are present here, but they are to the radial side. This is to the carpi side. Okay. Now another is there are another pronator quadratus. There is the pronator quadratus. So to these all muscle only the median nerve supply to these all muscle. Okay. Now we move to the back side, and to the back side you will see that there is the unconeus muscle. Unconeus muscle is just direct to insert into the this olecranon process. Okay, this is the unconeus muscle. Now remove from start from this area, extensor carpi ulnaris, because this is to the ulnar side. Okay, remove it, and another is the extensor digiti minimi, because it's attached to a digit. Okay, now another muscle is the extensor digitorum. This is extensor digitorum. Okay, now other is the extensor carpi radialis brevis. Radialis brevis, one is the brevis, one is the longest. You will see this is the brevis because it attached from this area, and the other is the longest because it attached from the supracondylar region. This is from the lateral epicondyle, and this is from the lateral supracondyle, from this area. So this is long because it starts from first side. Okay, from the above. So this is longest and this is the brevis. So remove both of them. After that you will see there are another muscle, that is supinator, and supinator help to supine the arm. They actually supine the arm, supination. They help in the supination. Okay, so remove this, and supinator muscle are also supplied by the radial nerve. Okay, now this is the brachioradialis. This is actually the brachioradialis muscle. Okay, now another there are the abductor pollicis longus. Now it start about the abductor. It is attached to a lateral side, that's why it is called abductor. So it is abductor pollicis longus, and this is called extensor pollicis brevis. Abductor pollicis brevis, extensor pollicis brevis. These are two muscles. Okay. Now see here there are the extensor pollicis longus. This is the extensor pollicis longus muscle, and this is the extensor indicis. Okay, extensor indicis. Now come here and see the other muscle. There are three muscles: abductor pollicis brevis, flexor pollicis brevis, and abductor pollicis brevis. Abductor pollicis brevis, flexor pollicis brevis, and adductor pollicis brevis. These are called thinner muscle. Okay, these are the thinner muscle. Apponens pollicis, they also include the apponens pollicis. Okay, the adductor are not included. Now in the hypothenar are also three muscle. Palmar brevis are not present in it. Okay, they are actually attached to the flexor palmar ulnaris. Just remove this is palmaris brevis. Now there are three muscle of the thinner hypothenar. One is the flexor digiti minimi brevis, and this is the abductor digiti minimi, and this is the apponens digiti minimi. There are three muscle. Okay, three muscle. One is the flexor digiti minimi brevis, another is the abductor digiti minimi. Okay, and this is the apponens digiti minimi. Now again come here and see the all the muscle. This is the lumbrical, fourth lumbrical. This is the third lumbrical. This is the second lumbrical. This is the first lumbrical. So you have to about the lumbrical. Lumbrical are actually arise from the origin is actually from the digitorum profundus tendon. There are the tendon, and from this tendon the lumbrical are arranged. And actually lumbrical what can do? Lumbrical function is just like this. If you this is your hand, okay, and you can put your hand like this. So lumbrical work on this, okay. So this is the lumbrical, all the lumbrical, okay. And now there are lumbrical, there are introsci. One is the palmar introsci and the other is the dorsal introsci. Dorsal introsci work and they abduct, they abduct the finger, for example abduction toward each other, toward the middle side, okay. They cause abduction. There are four palmar introsci and four dorsal introsci, okay. So we have discussed all the muscle completely, and in the next video if you watch we will complete 3D diagram of the best app. We will use the best app, okay. For that you can subscribe the channel, we will upload that video, okay. Thanks for watching. Bones of upper limb, okay. So bones of upper limb are so easy. So first of all there are the bones which we will discuss, okay. So there are this bone, this is called humerus, okay. This is actually humerus bone, humerus bone, okay. But before this I will remove all the muscle from this, that you will see each and every bone, okay. Now I removing all the muscle from here, okay. And after that you will see all the bones from outside, okay. So you will see in 3D dimension. So just see from the upper side and from the lower side and from all over side. So this is the scapula bone, okay. And from the posterior side there is a spine. This is called spine, and the muscle before above the spine is called supraspinatus, and below the spine is called infraspinatus, okay. And this is the clavicle. This is the clavicle. It is concave. It is concave to third, okay. And one third, okay, and two third, this is the convex from anterior side, okay. Now you can see here the from the upper side there are many muscle attached. This is the muscle attached to here, the different muscle attached to here, okay. Sternocleidomastoid etc, different muscle attached here, but they are not showing, okay. So the deltoid muscle attached to deltoid pectoralis major muscle, all muscle attached to this. This is the clavicle, okay. We remove the clavicle and the scapula. Now this is the humerus, and to the lateral side there is the radial bone, okay, radius bone. And this to the medial side there is the ulnar bone. And also now move below and you will see all the carpal bones, okay. Carpal bones are also so much important here. So in the carpal there are many flexor, there are many reticula present. We remove all the retinaculum, okay. The tendon and retinacular, okay. So this is the scaphoid bone. This is the scaphoid. After the scaphoid there is the lunate. After the scaphoid there is the lunate bone, okay. There are the lunate bone, scaphoid, lunate, triquetrum and falciparum. Then after them triquetrum, capitate, hamate, and she looks too pretty. You have to remember that she looks too pretty. She looks too pretty. Try to catch her. So you have to remember like this, okay. So scaphoid, lunate, she looks too pretty, triquetrum, falciparum, and trapezoid, trapezium, trapezoid, capitate, hamate. These are the eight bone. Okay. After that, there is the this is the metacarpal. This is the metacarpal. Okay, and after that there are phalanges. This is the two phalanges. Here are three phalanges. Three phalanges are present. Okay, so this we have discussed all the bones. Now we will discuss each and every bone. Okay, yeah, in the slide. Okay, this is the Adil Banduk slide, and you can you can watch his lecture on the YouTube. But if you can't know the language, there no language, English language is little bit different. Okay, if you can't know, then this lecture is, then I will provide that this will be best. Okay, Adil Banduk slide. So wait for a second, that there is the, so now this is Adil Banduk slides. You can watch his lecture, okay, on YouTube. But if you can't, let's start. So there are shoulder joint. Okay, shoulder girdle, arm, forearm, and hand. In shoulder there are clavicle and scapula bone. Okay, in the arm there are humerus. In the forearm there is radius and ulna. In the hand, carpal, metacarpal, and phalanges. Okay, this is carpal, metacarpal, phalanges. Bones on the shoulder. Shoulder have two bones. One is the clavicle. Clavicle have one sternal end, that is toward the sternal side, and one is the acromion side, that is toward the acromion side. Now from the upper surface of the clavicle, you can see this is the posterior surface, this is the anterior surface. Anterior lateral, one third is the convex. This is one third is convex. Okay, posteriorly. If you see it from posterior, one third is convex posteriorly, and here one third is convex anteriorly. Here is convex posteriorly, here is convex anteriorly. Now shaft is made of medial 2/3 and lateral 1/3. Lateral 1/3. Four surface: anterior, posterior, superior, inferior. Now medial end and lateral end. There are two end. There are two end. One is the medial end, one is the lateral end. Okay, so medial, the lateral end, there is a acromial end. Okay, and another thing is about, you have to understand, now we will see this is the sternal acromion end shaft of the, now there is the medial end and lateral end. Lateral end is toward the acromion, medial end is toward the sternal manubrium, and here are the sternoclavicular joint. This is the sternoclavicular joint. This is first costal cartilage. Okay, and this is the costoclavicular ligament. Now move toward another slide. That is, if you see from the upper side, from the lower side. Okay, from the lower side you will see these muscles. That is from the upper side. This is from the lower side, and this is from the upper side. So from the upper side you can see trapezius muscle is attached and deltoid muscle is attached. I have already told you that deltoid is where is present. Sternomastoid muscle is attached. Okay, now come here to the inferior side. There is trapezoid and conoid tubercle, and coraco-clavicular ligament is attached to both of them. Okay, here is deltoid. There is a subclavius muscle attached to inferior side, and here is a costoclavicular ligament. Okay, and pectoralis major also attached. Now function of the clavicles connect the upper limb to the axial scalene, transmit forces and give attachment to the muscle. Now come here, difference between clavicle horizontal, no medullary cavity, first bone to ossify membrane and commonly fracture. Now about the scapula. Scapula are three angle, three border, and three fossa, and three process. Triangle is superior, inferior, lateral. How? This is the superior, this is the inferior, this is the lateral. So three angles. Superior. Now border is the superior border, medial border, and lateral border. Okay. Now three fossa. One is the supraspinatus, this is the supraspinatus, and this is the infraspinatus, and this is the subscapularis fossa. Okay. Three process: spine, acromion, and coracoid. This is the, on posterior side, this is the spine, this is the acromion process, this is the coracoid process. Okay. Now second rib, spine, this is the spine, this is the acromion. Now angle, border, fossa, and process. Okay. Now this is the acromion, coracoid process, scapular notch, superior angle. These are we have already discussed all of them. Okay. Now about the humerus. What is humerus? Humerus have two end, upper and lower end. Upper end have head, neck, greater tuberosity, lesser tube. Lower end have two epicondyle, three foci, and trochanteric capitulum. So this is the upper end, upper hand. This is the anatomical neck. The anatomical. This is the surgical neck. Okay. This is the greater tubercle. This is the greater tubercle, and this is lesser tubercle. Okay. Greater tubercle, lesser tubercle, and between them this is intertubercular sulcus. Okay. Now there are two condyle. One is the medial condyle and one is the lateral condyle. Another thing you have to know that the head is toward the medial side. Okay. And there are fossa. We will discuss the fossa. This is the head, anatomical neck, surgical neck. We have already discussed it. Okay. Now lower end have one is the trochlear capitulum. Now you have to understand that where is the trochlear, where is the capitulum. For that purpose, you have to remember that crazy tulip. Crazy tulip. You have to remember this tip. So C and R, T and U. C mean capitulum is along the radius. So capitulum is along the radius, and trochlea is to along the ulna. Trochlea is along the ulna bone. Okay. So this is about the bone. Now coronoid fossa. One is the coronoid fossa, radial fossa, medial epicondyle, lateral epicondyle. One is the medial epicondyle, the other is the lateral epicondyle. So one is the radius and the ulna. Now come here. There is the articulations. Upper end and lower end. Upper end is the shoulder joint and lower end is the elbow joints. Okay. So the shoulder joint is the ball and socket synovial joint. Lower end is the trochlea, articulate with the trochlear notch of the ulna. These articulate with the trochlear notch of the ulna, the lower end. Okay. The trochlea along the ulna, but it attached with the trochlear notch of the ulna. Now capitulum. Capitulum is actually attached with the head of the radius. Okay. Now bones on the forearm. Forearm have two bones. One is the radius and the other is the ulna. Radius. This is radius. Radius have head on the superior side, not on the distal side. Okay. Proximal side. So radius is toward the lateral side. Ulna is toward the medial side. So you have to remember this. Now radius. Each has two end, upper end and lower end, and shaft. Okay. Now ulna, we will discuss ulna. Ulna upper end have two notches and two processes. Two notch and two process. Two process. One is the olecranon process and another is the coronoid process. Coronoid. In the scapula there is the coracoid process. Okay. So this is the coronoid process. And this is the trochlear notch. Trochlear notch we have already discussed. This is the radial notch because there is the head of the radius attached here. And now about the trochlear notch have discussed, radial notch. Now the process have already discussed. Okay. Two process. One is the olecranon process, another is the coronoid process. Here is the supinator crest. Supinator crest means here the supinator muscle attached here. Okay. Now this is the radial notch, coronoid process, olecranon process, ulnar tuberosity. Now come here to the ulna. Lower end. Lower end have one head for the style. One head and styloid process. Head articulate with the ulnar notch. Actually we have in the ulna. Radius. This is the ulna. Okay. But you have to remember lower end have head of ulna. Okay. The head of ulna is present at the lower end. That head is articulated with the ulnar notch of the radius. For example, this is the radial. This is the ulnar notch of the radius. This is the radius. So radius is ulnar notch. Okay. And it is a head. This is the head and other is the styloid process. Styloid process can be palpated if you place your thumbs etc. here. Okay. You can palpate it. Okay. Now it's separated by the carpal bone from articular that does not take part in the formation of the wrist. You have to remember that this ulnar bone not take formation in the along with this bone because they are separated. They have a radial notch. Now about the radius. Radius have three parts. One is the head, another is the neck, and other is the radial upper part. Upper part has three hands. One is the head. This is the head. Okay. This is the neck, okay, and this is the tuberosity of the radius, radial tuberosity, okay. Now we will discuss the muscle. One head, two neck, one head. This is the head, this is the neck, and this is the tuberosity, okay. Now can you see there are annular ligament? You have to remember this ligament. That is the called annular ligament. Annular ligament and is present here that help in the attachment of the radius. Now radius have lower end five surfaces: anterior surface, posterior surface, medial surface, lateral surface. Okay, and anterior surface, you can see this is the anterior surface and posterior surface. Posterior surface have dorsal tubercle. You have to remember that posterior surface of the radius have dorsal tubercle on the lower end, and the head of the radius is present at upper end. Okay, but the head of the ulna is present at lower end. These are both of them are opposite. Okay, now anterior side, posterior side have now medial side have ulnar notch. Medial side have ulnar notch. There are ulnar notch on the lateral side form a styloid process. This is the lateral side and they form a styloid process. So there are this is also styloid process of the ulna. This is styloid process of the radius. Okay. Inferior surface articulate with the scaphoid and lunate. You have to remember SL scaphoid and lunate articulate with the radius. Okay. So this is the radius. This is the ulna. But if you supine at supine position, this is like this. Okay, now skeleton of the hand, three part. One is the carpal bone, metacarpal bone, and phalanges. So this is the carpal bone. And carpal bone, how can you remember? Just like I will tell you, you have to she looks too pretty. She looks too pretty, try to catch her. I will write here for you. You have to write, she looks too pretty. She looks too pretty. Try to catch her. So she means scaphoid. This is the scaphoid. This is the lunate. This is the tricutum. This is the falciform. So this is the first row. Okay, proximal row. And the distal row is try to catch her. Trapezium, trapezoid, capitate, hamate. Trapezium, trapezoid, capitate, hamate. These are the second row. Okay. Now shoulder girdle. Shoulder girdle have two bones. One is the clavicle, another is the scapula. This is called the clavicle, and another is the scapula. This is the scapula. Okay, clavicle have two end. We have already discussed this. Okay, but why this is coming again? Now here are the attachment of bones, etc. Okay, so if you want to discuss, we will discuss it one by one. Now again we will come here and tell about the shoulder girdle, have then fracture of the shoulder. This is actually the muscle. Now let's come here. Okay, scapula have triangle. We have already discussed it, but now muscle attachment. Okay, so here are the supraspinatus muscle attached, here the infraspinatus, and here the for example, this is the 1 number position, this is 7. So at 7 there is the teres minor. So here are the teres minor, here are the teres major muscle attached, and here at the 9 the latissimus dorsi attached to at 9 position. Okay, now at 3 there are subscapularis muscle are attached. Okay, 4 at 4 there are the levator at 4, there are levator scapula, and here at the 5 there is the rhomboid minor, and at the 6 there is rhomboid major. Rhomboid minor, rhomboid major muscle are attached to here. Okay, now rhomboid minor, rhomboid major, teres minor. Now the three dorsal lip of the letter teres minor, teres major, latissimus dorsi. Okay, this is attached here. Now 18 muscle. Now there are long head of to the two glenoid tubercle. One is this tubercle in superior glenoid tubercle, one is inferior. So here is the muscle attached that is called, for example, long head is the supraglenoid tubercle. To this area, the supraglenoid tubercle muscle is attached. Long head of the bicep muscle attached to this area, supraglenoid tubercle, and long head of tricep attached to the infraglenoid tubercle. Okay, this is the infraglenoid tubercle. The acromion deltoid at 13 position there is the deltoid muscle attached. At 14 there is the trapezius muscle attached. At 15, 16 short head of the bicep and coracobrachialis. 15 and 16. Where is the 15, 16? Actually, coracobrachialis is attached to a coracoid. This is the coracoid process. Okay, and short head of biceps and coracoid process. This is attached to here. Okay, and pectoralis major. 16 pectoralis minor is also attached to here. Where they are not showing again. 17 at 17 position. Here the pectoralis minor muscle are attached. Okay. Now come here to ligament of the scapula. Scapula have suprascapular ligament, coracoclavicular ligament, conoid ligament, trapezoid ligament, coracoacromial ligament, coracohumeral ligament, glenohumeral ligament. Okay. These all ligament are attached to here. Okay. Now about the humerus. Humerus have, and we have already discussed it. Now to the greater tubercle, what things are attached, and to the lesser tubercle. So this is the greater tubercle. Now we will tell about the articulations. Upper shoulder joint, head, remove this muscle attachment. We have discussed infraspinatus. All have these are discussed. Okay. Now another thing is the supraspinatus, infraspinatus, teres minor. They are attached to a greater tubercle. Okay. They are attached to a greater tubercle, and the subscapularis. These four muscle form a rotator cuff muscle. Okay. Now muscle attachment of the humerus. There are 7 insertion. 7 insertion are here. You can see at the 5. There is the pectoralis major muscle attached, lateral lip. And at the 7 there is latissimus dorsi, and there is the teres minor. Pectoralis minor, latissimus dorsi, and teres minor. Teres major. Okay, so these are to the insertion of the muscle. Okay, now lower end of the humerus, medial epicondyle, lateral epicondyle. Medial epicondyle is the common flexor origin. Actually, the medial epicondyle is actually, this is the this is not posterior side, and posterior it become anterior side. So this is the medial epicondyle. This is the medial epicondyle. This is the lateral. So common flexor origin to medial epicondyle. This is the medial epicondyle. To medial epicondyle there is common flexor origin. All the flexor muscle attached to it. Okay, and common extensor muscle attached to the lateral epicondyle. Okay. Common extensor also are, all of them are attached to extensor. Now nerve related to the humerus. One is the axillary nerve, radial nerve. So this is the axillary nerve, this is the radial nerve in the radial group move, and this is the ulnar nerve move behind the epicondyle. These are behind the medial epicondyle. This MCQs comes again and again. Okay. Now fracture. Humerus fracture at the axillary nerve. Humerus fracture. It's at surgical link. For example, at surgical link, the axillary nerve were damaged. At the mid shaft, there the radial nerve were damaged. At the medial epicondyle, there will be the ulnar nerve damage. Okay. Pectoralis region. We will after this we will discuss the pectoralis region, and after something pectoralis region, forearm region, and arm region, head, etc. All of them we'll discuss one by one. Okay.